My favorite job is that of being a mom to my 3 kids, and even though they're getting older, moving out, getting married, every mom agrees that having a baby changes her body, and oftentimes it's not a welcome change. If diet and exercise aren't enough, you might think about a mommy makeover. And joining me now is Dr. John Wakelin with Columbus Aesthetic and Plastic Surgery. Welcome, doctor. Nice to see you.
Nice to see you. Thanks for having me.
I like the term mommy makeover. What do you mean by that?
Well, it's a commonly used term. There's sort of a catch-all, if you will, for a variety of different procedures that are frequently done for moms after they've had children to try to address some of the otherwise irreparable changes that have happened to their bodies from having children.
Well, and sometimes just gravity takes over too. I mean, that's just a fact of life.
Time passes, gravity takes its effects, and of course pregnancy does as well. And so many of these procedures are actually designed to address each of those issues and the effects that those have had.
So can you outline some of these procedures for me, doctor?
Certainly. So probably the first thing that comes to mind for a lot of moms once they've finished having children is the fact that when they're pregnant, the skin stretches out on their abdomens, the muscles sometimes get quite stretched apart. Mm-hmm. And some people are luckier than others in terms of how much skin elasticity they have, and whether or not those muscles go back into place. Obviously, the more children you have, the more chance there is that things haven't sprung back as much as you'd like. So a tummy tuck, or what we refer to as an abdominoplasty, is probably the number one procedure that people will talk about when they talk about mommy makeovers, to try to not only tighten the skin, get rid of some of the extra skin and the stretch marks, as well as tighten the muscles to try to get some of that abdominal contour back.
It's interesting because you mentioned that every woman's different. So some women, even with diet and exercise, they don't have a problem, but depending on your own physical build and things, it could be an issue.
Absolutely. A lot of it has to do with genetics, how large your children were.
If you had twins or triplets.
When I see lots of moms that have had multiples, certainly, but at the same time, you may see somebody that has only had one child, and still things get stretched out.
Okay, so. Stomach, what else?
So we do a lot of breast surgery as well. As you can imagine, from nursing, people do have some significant changes, as well as just the pregnancy alone. Often that is just replacing some of the volume that was maybe lost after pregnancy. At the same time, other women find that they're bigger than they want to be after pregnancy, and even maybe have some extra stress on their shoulders and back and neck, in which case we can maybe do a reduction, and frequently either of those procedures are combined with some lifting as well to counteract some of the effects of gravity through the whole process.
You mentioned that a woman should wait until she's finished having children, which I guess makes sense.
So for many of the procedures, in particularly the tummy tuck, because having another child would just stretch things back out.
Right.
For the breast surgery, depending on the individual and the type of surgery that we're talking about, it may be advisable to wait until after, although not always. And then we do a lot of liposuction procedures as well. And what those do are to try to contour areas where there are problem areas of fat that just won't go away. Sometimes those were there well before pregnancy as well. Sometimes they're just a little bit more stubborn after pregnancy.
I guess the best way for a woman to find out what you offer and what she needs is a consultation.
Absolutely. The best thing you can do is you go to a well-trained and reputable board-certified plastic surgeon, so that they can give you an opinion of what the options are that are available to you, and that way you can have that information to make a really well-informed decision.
That's great stuff. Thank you very much, doctor. Nice to talk with you.
It's great to talk with you. Thank you for having me.
Glad you can make it in today when all this snow.
It was a pleasure.
Thanks.